perform the basic life support. Basic life support is a level of medical care which is used for victims of life-threatening illnesses or injuries until they can be given full medical care at the hospital. It can be provided by trained medical personnel such as emergency medical technicians and by qualified bystanders. Emergencies can happen anywhere, so it is important to know how to provide basic life support care. As you approach the scene of an emergency event, check your surroundings to ensure that they are safe and only kneel on the side of the victim. After that, tap the victim's shoulder and shout, "Are you okay?" If the victim is unresponsive and you are alone, call for help and check for breathing. Open the victim's airway. Use the head tilt and chin lift technique. Press down on the forehead with one hand while pulling up the chin with the other hand. Gently tilt the head back. When checking for breathing, listen to the sound of breathing. Feel for exhalation on your cheek. And look to see the victim's chest if rising and falling. If the victim is not breathing and there is another rescuer, ask him or her to call an ambulance. If you're alone, call one by yourself. The emergency medical dispatcher will give you an instruction on how to provide cardiopulmonary resuscitation. Place the victim in as you find or place up position on a firm, flat surface. Kneel at the victim's side. Place one hand on the top of the other hand and interlace your finger. Place heel of your hand on center of the victim's chest. On the lower half of the breastbone, position shoulder directly over your hands. Keep your arms straight and lock your elbows. Compress the chest 30 times to a depth of 5 to 6 cm. Then allow for full chest recoil. Chest compression should be steady and fast. Perform at a rate of twice a second. You can even count if it helps. 30 chest compressions are followed by 2 ventilations. Tilt the victim's head back and hinge the nose shut and blow into the victim's mouth. Watch for the chest to return to its normal position while taking another breath. Repeat the sequence. Minimize interruptions and chest compression to last no more than 5 seconds. Alternate the 30 chest compression in the 2 ventilations until help arrives. If you have another rescuer with you, switch position every 2 to 3 minutes because providing CPR is tiring and become less effective. When you see signs of the victim regaining consciousness, such as breathing, coughing, or moving purposefully, stop CPR and put the victim in a recovery position.